evening, students. Today our lecture devotes the topic System of blood and hematopoietic organs in children. Blood is liquid tissue that washes almost all cells of organism, oxygenated them, provides all types of metabolism, carries out a protective function. Due to a presence of phagocytes in your body, blood consists of plasma and uniform elements, self-weighted unit erythrocytes, leukocytes, and platelets. The analysis of blood, one of basic laboratory scheme in medical practice. Please, I will give you task, analysis of blood, and I ask you interpret how we interpret a blood test. It is possible to define pathological change in the organism of using the hemogram. What features of hemogram of developing organism? A fetus has permanent growth of number of erythrocytes, maintenance of hemoglobin, amount of leukocytes. In the first half of antenatal period, to 6 months, the amount of emesia element, erythroblasts, myoblasts, and myelocytes prevails in blood, and a feature are mainly measure elements. This is indicator of red blood. On left column, we have elements which we use constantly. And second graph, we have elements which we receive by automatic hematological analyzers. Erythrocytes remove of oxygen forms lungs to the organs and tissues, and carbon dioxide backwards is taken away from tissues and transferred back in lungs. It is part of process that is named breathing. A red color of erythrocytes, acquire of hemoglobin includes erythrocytes into an active form and then give to tissue of organism. The function of it consists with oxygen convert into an active form and then give to tissue of organism, except if hemoglobin is able to link with 15% carbon dioxide in tissues and give it in lung. Consists of peripheral blood in the first day after birth changes considerably. After birth in the blood increasing amount hemoglobin. Please look. This is normal of red blood in newborn. I give task analysis of blood in newborn. Please compare my task with normal. In the end, you should give conclusion. What is erythrocytes? Erythrocytes, normal of children, for children depends on age. The decline of maintenance of erythrocytes and hemoglobin begins from the end of the first 24 hours. During first months, the life amount of erythrocytes goes down sharply, reduction of the 2nd, 3rd months to 116, 113 gram on liter. This is considered as a critical period in life, which named physiological anemia. You should remember about it. There is 4 on 10 on 9 gram on liter degree of first year of the erythrocytes with maintains of hemoglobin arrives at the 110-120 gram on liter. Hemoglobin, low bound of norm hemoglobin for children of early neonatal age and limits of at 170 gram on liter. For adult, for young adult, this is pathological change, but in newborn, this is normal. On the second week life, the level hemoglobin goes down, but makes no less than 145 gram on liter. On 4 weeks to 120 gram on liter. The presence of large number of young immature erythrocytes in the intensive erythropoiesis as reduction of fetus, then entry of oxygen. Please look at the table with normal of erythrocytes and other elements of red blood after the first year and compare with my task. At the second, third month goes down, the erythrocytes and hemoglobin next again increase. On amount of hemoglobin in a blood, it is possible to set the degree of anemia. We distinguish different stages of anemia. Easier degree, the level of index below that norm, but no less than 90 gram on liter. Middle, between 90-70 gram on liter. And severe, the level of hemoglobin less than 70 gram on liter, but not below that 50 gram on liter. If we have 50 gram, less than 50 gram on liter, this is extremely severe degree. And hemoglobin in less than 10% impossible because it's deadly. Color index. What is it, color index? It is relative saturation hemoglobin in erythrocytes. Maintains of hemoglobin is in erythrocyte. In a normal, for children, it changes depend of age, because in increased blood specialty, adult hemoglobin. Color index is used for diagnostic of different anemia. 0.8 and less, this is hyperchromic anemia. If we have level 1,085 to 1, this is normochromic anemia, and more than 1 hyperchromic. On occasion, for diagnostic of diseases of blood, it is important for determination of form and size erythrocytes. Please look, what is it, poikilocytosis? This is change of form. And anisocytosis is change of sizes. This is important for our conclusion. This change also testified to the presence of different of blood and poisoning different toxic substances. Reticulocytosis. What is it? are immature young erythrocytes. It is an index of normal work of marrow production, the new cells of erythrocytes. In blood at newborn contained high percent of reticulocytes to 50%. At the end of 4th week, amount of reticulocytes quickly goes down and arrives 3 to 12-25% maybe. Reticulocytes, increase of number of reticulocytes in relation to the general amount of erythrocytes is considered a good sign if patient treat oneself from anemia, because appears new emerging elements. Erythrocytes and limitation rate. This is important parameters. It is determined in order to define the dynamic during of disease and also expressed of inflammatory process. What more bigger mass of erythrocytes, the higher speed of ESI. What more erythrocytes are in blood, the less speed of erythrocytes limitation rate. More often all these index increases, not immediately, and in 3rd, 4th day from the beginning of diseases. It is maximum number appear at the beginning of recovery. Please estimate the indexes of erythrocytes of red blood. What's your conclusion? Please, you. What's your conclusion? Red blood. What's your conclusion by red blood?
Normal.
What's your opinion?
Normal erythrocyte.
Normally?
Yes, ma'am.
All parameters normal.
No, ma'am. Hemoglobin is less.
What's your conclusion?
Hemoglobin is less in number.
What's your conclusion?
Ma'am, it is as the child will grow with age, then the hemoglobin concentration will decrease. Anemia also.
And do you agree with me?
Yes, ma'am.
Okay, please continue. This is table about amount of thrombocytes or platelets. What is it, thrombocytes? Thrombocytes are blood plates that have appearance of shallow, small colorless particles, rickets or giant cells, and megakaryocytes from that blood clots are formed. Platelets live 2 to 11 days, collapse in the liver and spleen. Thrombocytes forming a clot causes the area damage in the vessels, the same stopping bleeding. If you have damage of vessels, the thrombocytes can stop bleeding. Okay. For a child can be thrombocytes in increase of platelets in blood and thrombopenia if reduction of blood platelets. Next, this is table about white blood cells. This is leukocytes, about leukocytes. This is very important parameters indicator. Please keep silent. Leukocytes. It is white cell of blood responsible for immunity. Norma of leukocytes of blood for children as rule changes in accordance with their age. Then younger child, the white blood cell count of higher in his blood. As far as the height of child, the amount of leukocytes is higher in his blood. But with growth of child, the amount of leukocytes goes down. Leukocytosis, what is it? This is increase of amount of leukocytes in the blood. This is maybe inflammatory process in the organism. Leukopenia, reduction of amount of leukocytes in the peripheral blood, being rarer, can be viral diseases and chronic inflammatory process, immunodeficiency. There are few variants of leukocytes. Granulocytes, that is cytoplasm, contain granules with enzymes which dissolves pathology. Granulocytes are eosinophils, basophils, and neutrophils, and agranulocytes, which include lymphocytes and monocytes. Percentage ratio of different types of leukocytes to general amount of leukocytes in blood, named leukocytes formula. In the process of the children growth, most change take place of leukocytes formula. Please. What is it, eosinophils? Eosinophils are cell-absorbed immune complexes. The amount of eosinophils at children is same in any age and approximately limit 1, maybe 5% in blood. The increase of eosinophils amount show about allergic reaction and aptitude. What is it, basophils? It is blood, it is cells of blood of granulocytic type. It participates in an inflammatory reaction and in the immune answers of organism for foreign agents. Normal amount 0.1%. Neutrophils performs the protective duty in the organism, absorb and digest foreign bodies. This is active member. The basic part, it is neutrophils contained in marrow and in blood only 1%. If the amount of neutrophils reduction, it is talked about neutropenia. If rises, neutrocytosis, lymphocytes. It is main cells of immune system. I think that you know, but we have different lymphocytes, T and B lymphocytes. They product protective antibodies and able to destroy the cells of organism that losing or changing properties. What is it? This is a relation between neutrophils and lymphocytes. On higher position, we have neutrophils. Neutrophils can be in 165 and the lymphocytes 25. On the 58, we have 45 same quantity and equal 45. This is first decassation. During first year, the quantity of neutrophils decrease on 1% each month. 1% each month. But lymphocytes decrease on 1%. For example, the baby at 6 months, how many lymphocytes should have? 39 and lymphocytes. Therefore, on the first year, we have 33 after first year, the amount of neutrophils increase, lymphocytes increase. Why on 3 each year? 3 neutrophils each year. For example, at 3 years old, we have to increase for 3 plus 3 until 39. And the lymphocytes decrease in each month. And we have second pulsation at 5 years. What do you find? Neutrophils continue to increase, lymphocytes increase, and at 12 years old, this formula has done. This is why I explained. The estimation of leukocytosis formula maintains is first of all compare macrophiles old and step young neutrophils. Comparison of conducted, not all absolute maintains and on the degree, rejection of every kind from the normal accepted for it. If in the blood is more the old segment neutrophils, blood cells we called leukocytes move to the right. If more young cells, this is the formula, turn on left. The change of leukocytes formula to left is observed at acute inflammatory process, fasting process, intoxication, hemorrhages, and other protective cell in great numbers. The change leukocytosis formula to right is observed at chronic inflammatory process. Monocytes. The cell of white blood that does not contain granules have a large size. It is basic function to take in the dissolve harmful microorganisms. In a norm, their amount approximately from 2 to 12% for children to first year, for children older than first year, as well for adults from 4 to 80%. Maybe, sorry, for 8%. This is mistake, for 80. Enhanceable amount them in blood a presence in the organism of viral infection. Infectious mononucleosis, toxoplasmosis, malaria, and other. High level of monocytes in blood is one of sign of heavy leg infectious process, tuberculosis, disease of heart, and also malignant diseases. Several. And I want to give information about life expectancy of major element cells of blood in a vascular bed. Reticulocytes lives 120 days. Thrombocytes or platelets 9-11 days. Neutrophils 14 days. Lymphocytes from a few hours to few years. Eosinophils 8-12 days. Monocytes circulate in blood 12 hours. After get to tissue, they grow into macrophages. Please look on my task. What's your conclusion about white red blood? Who can give answer? Please look.
Leukocyte concentration is
What?
more.
More. Leukocytes more. And next stage, what? Eosinophils more. Okay. Please look a relation in leukocytes, neutrophils, relation between neutrophils and lymphocytes.
When lymphocyte at 22 days is also more less man because 46 will be on the
This is understanding.
40.
This relation between neutrophils and lymphocytes, what relation? Normal or not?
No. Leukocytes increase concentration indicates inflammatory processes that there is any inflammatory disease in the body.
Acute or chronic?
Acute man.
Okay, maybe. My conclusion. Leukocytes, neutrophilia withstand change and eosinophils. It is important to remember that change in blood gives information just that there is a certain pathological process in an organism, but we cannot determine the clinical diagnosis, origin, the reason of change. A doctor describing the analysis of blood. There is our difficult cognitive work by the result of that, and there will be raising of diagnosis and setting to the same treatment. During all lecture we compared this blood test to the normative indexes. Now please give a common conclusion. Common conclusion. Anemia of physiology, remember? And leukocytosis to a neutrophil
Change. Eosinophils.
Agree with me?
Yes.
Eosinophils.
Acute inflammatory. Acute inflammatory.
Then I'm satisfied. I'm satisfied. I think that you understood my answer.
Yes.
Thank you.